The mission of Responder Assist is to improve mental health outcomes for Victorian emergency service workers, whether they be paid, volunteer, or even retired.
And so we do that through having a network of expert clinicians, the experts in delivery of services, my team, which has the knowledge of research, bringing people from all of these backgrounds together with the common goal of improving the types of treatments that emergency service workers receive.
As a group of individuals who put their lives on the line every day, they are much more vulnerable to the impacts of trauma, the cumulative impacts of trauma over time.
One of the frustrations of emergency service workers is the inability to access treatment with clinicians who are familiar with their background and their circumstances.
Mental health practitioners are very well versed in the treatment of mental health disorders, but there are just some special nuances around the culture and organisational factors and operational factors that are encountered by emergency service workers that not all community clinicians may necessarily be quite so familiar with.
So we need to be making sure that when we're looking at mental health programs that we have the right assessments and treatments which are evidence-based, which take these factors into consideration.
Most of my adult life I've worked in emergency services. I was a member of Victoria Police as a serving member for 21 years and then 4.5 years with the Police Association as the manager of wellbeing services. In all of that, I also experienced a significant mental health injury myself. That experience of being a member and then dealing with a lot of members who are experiencing the very same barriers that I did about reaching out and getting help really puts me in a unique position to be able to provide advice and guidance around how we can put the member at the centre of any model that we design.
My role in this was really to ensure that we were setting up good model of care, that we have in place good clinical governance procedures, that we are recruiting clinicians who are well trained in evidence-based treatments and in understanding the culture of emergency service workers and their unique needs.
That's where Responder Assist can be really effective in not only delivering the cultural competency pieces, but then follow-up training around the evidence-based treatments.
Supporting health practitioners is one of the key aims of Responder Assist, and we want to do that by building their capacity but also their confidence to be able to work with emergency service workers.
Any clinician who might be working with an emergency service worker can call us and speak to a specialist in emergency worker mental health.
And then we also have our research and quality improvement function of Responder Assist.
The way that in which research can help inform the service is through what we call a quality improvement process, collecting the data from patients, looking at their satisfaction with the service, also looking at the practitioners' perceptions, and we can use that information to then feed directly back into the service in real time and make tweaks or adjustments to the service if needs be.
We're making sure that what we're doing is also providing a range of information and services which are targeted also at family and friends.
If we're thinking about that network of people to have around us, it really is important to share, to acknowledge and understand that sometimes I will need some support, and it's okay to ask for that support.
And it's vital that family members are on board with that, understand the process and are there to support their family member through that.
Stigma is a strong driver amongst emergency service work agencies. In that type of industry, it is hard to put your hand up and say, I need some assistance. A real benefit of Responder Assist is that it's confidential and it's independent.